We'll go ahead and start with SB297, for substitute congregate care amendments. Senator McCall.
Cool. So I will have some folks online, and I have good news for you. There's a fifth substitute online, and I want to address that as well. And I don't know what order you want to take that, but I want to walk through some of the things that we did in the fifth substitute. We've had some industry folks that I've worked with, and we've had a chance to address. I think most of the concerns have been addressed, so I'd like a chance to walk through those. But I do have some folks that'll join me. I've got the director from Intermountain Primary Children's. I know she's here. Katie Silvers is online. You should be able to see her. And then Caroline Lorson. But with that, I know the fifth substitute just hit, and there's a lot of folks that haven't seen it. So if it's okay, I'd like to jump through some of those concerns that we addressed just to make sure that they're aware of what those changes are. And you'll see in the online version of the bill, if you jump in the comparison, we did fix some language at 921 in the bill. Some of the language, one of the concerns we were trying to address with congregate care is what do we do when we have an employee who's being investigated for a problem that happened at one facility? How do we ensure that they don't get hired in another facility? So what we did is we took some language from DCFS, and what we're going to do now is make sure that they are supervised until that clears. Once that investigation clears, they're no longer needed to be supervised. So that is in the substitute. One of the other concerns that was brought to me is we have a definition of a critical incident, and when we have a transport group that moves a kid to and from a facility, if there's a problem, that problem is falling back on the program. So in the language, what we changed, you'll see in the comparison, we want to make sure that the only time that becomes a critical incident for a program is if they knew about the problem that could include force, coercion, deception, and failed to report it. And that seemed like a fair change. One of the other concerns that some of the facilities brought is we're going to have an ombudsman, and we want to make sure kids have a chance to call that ombudsman. But one of the concerns was if we put that phone right out in the common area, that it might be abused. Kids might order pizza or use it in a way that is inappropriate. So to try to address that concern, alleviate some of that concern, we just made sure that phone is available, and you'll see on line 1265 that change is there, where we provide the telephone, but we don't put it out in an area where it could be overused. There was also some concern about payment, collecting fees, and you'll see on line 1352 in the comparison that we're really making it clear that when there's billing and there's payment made, that ends the responsibility for that payment for covered services. Facilities programs had some concern about whether or not they were able to see what those bills could be through HIPAA, and we've got some HIPAA language in 1356 in the bill. We made some changes to the board. I think we have a really good board. I actually like coming before this committee. The bill contemplates having an advisory board that's going to work with licensing. We added one member in the substitute, but let me just run through the board members so you're aware. I've got a licensed physician, which I know we've got a couple here on this committee. We have a pediatrician who has worked with behavioral health. We also have a psychologist. We have a family therapist. Then we have two licensed therapists that have experience working in congregate care, and we have a therapist with experience working in juvenile justice. The point behind the advisory board is just to make sure that we're getting good information as we look at programs. But let me just walk through this. Congregate care legislation started in 2021, and we have an industry that's done a lot of good work, but there's been some concern. And it kind of grew up outside the regulatory structure. It grew at a very fast pace at a time where regulation didn't catch up. And in 2021, we passed and I don't want to call it a reform bill. We put the regulatory framework in place, and we did a really good job. But we've learned some things since 2021, and that's the point of the bill today, is to continue to address those concerns. And what this bill does overall, and I did want to go through those changes in the fifth substitute, but what we do first and foremost in this bill is we create this new advisory board. So licensing has an ability to have a group of experts that can make recommendations with standards, admission standards, treatment standards, suicide prevention standards. And you'll see, again, for Representative Ward and Representative Barlow, we put actually three physicians on, well, a psychiatrist and 2 physicians, one being a pediatrician with behavioral health experience. I think that is important to include. The other thing that we do in this bill is we create an ombudsman. Some of the concerns we've had, whether it's a sending state, sending parent, they want to have a place to go to if there's a problem. And one of the people that's on today is a parent, and I think it's important to recognize that these are kids that have families that care about them, but when they send them to Utah, if their concerns are not being addressed, providing an ombudsman for them to coordinate with, I think, is incredibly important. So we do that. In the bill, we also create a license provider civil money penalty fund. That was something that licensing wanted to have. But with that, as part of my presentation, what I'd like to do is invite Amanda Chaudhary from Intermountain Primary Children's to come and talk about some of the concerns that they've had at Primary Children's. If I go to that point, and then following Amanda, I've got Katie Silvers and then Caroline Lorson, and I know there's going to be several members of the public, but I don't want to steal the thunder from Katie. She's got some pretty significant data that I think is a concern that we're trying to address. So with that, Mr. Chair.
Yeah, we need to be sensitive of time. We have a hard stop at 4 o'clock.
Okay.
There's another committee, so.
We'll be quick, and can
okay.
I pass out some
I want to allow
materials?
time for public comment and those types of things, so yeah, go ahead.
Oh, you're good.
Thank you. Thank you, Mr. Chair, and thank you, committee members. My name is Amanda Chaudhary, and I'm the hospital president of Primary Children's Taylorsville, our pediatric behavioral health campus. I'm here representing Primary Children's Hospital and in support of SB297. I want to thank Senator McKell for working with us on this important issue. Primary Children's main concern is ensuring we keep the very limited resource of pediatric behavioral health inpatient beds in our state available for Utah's kids. Recently, Primary Children's Hospital took care of an out-of-state patient who was transported to Utah for residential treatment and ended up living in our hospital for 5 months. She was literally stuck, occupying a bed for 147 days. Our average length of stay is 7 days. That means we delayed or denied care for 22 Utah kids during the time the one out-of-state patient lived with us. This type of situation not only negatively impacts Utah's kids, but also these kids who know that they are stuck living in the hospital. And this situation is not unique. Primary Children's operates 3 inpatient behavioral health pediatric units totaling 53 beds. Every day we have a wait list for a bed. In total, last year, we took care of 169 out-of-state patients. That equates to 1,677 bed days occupied by out-of-state patients. And the average length of stay for an out-of-state kid on our unit is 30% longer than a Utah kid. That adds up to 18 Utah kids a month who could have been served by these spots. Taking care of out-of-state patients for behavioral health is especially challenging. Not only did taking care of these 169 patients occupy the limited beds, but their situations create undue burden on our system. They're more likely to have extended stays. Out-of-state patients are more likely to be covered by Medicaid, out-of-state Medicaid. They're more likely to have behavioral escalations that result in injuries of our workforce. They're less likely to have parental visits or involvement in their hospitalization. And they're unable to access any of the state or county mental health services in Utah because they're not a resident of our state. And they're unable to access those services in their home state because they're not physically located there. They've been moved to Utah. We understand and recognize that the congregate care industry exists to help kids. However, it's our responsibility to make sure that organizations bringing behaviorally complex kids into Utah don't place undue burden on Utah's hospitals and mental health system. delaying and denying mental health care for Utah's kids. For this reason, we ask that you support SB 297.
Thank you. Mr. Chair, the next person is Katie Silvers. She should be online, and Katie is the mother of Baruch Silvers, who actually died in a congregate care facility in Utah.
All right, Katie, go ahead.
Oh, Katie, you're muted, I think. Oh, there we go.
Chairperson Bullender, Vice Chair Hall, and Members Committee, thank you for allowing me to speak today. My name is Katie Silvers. My youngest son, Baruch, died just 3 months ago here in Utah while in a residential treatment facility. He was only 17 years old. We adopted Baruch and his brother from Ethiopia when he was 7. In Africa, Baruch lived on the streets suffering from malnutrition, neglect, illness, and abuse. And yet, despite these hardships, he was the happiest, most loving boy. His smile lit up every room he entered, and his eyes sparkled like diamonds. Baruch was hysterically funny, mischievous, and endlessly curious. He hugged every person he met and danced his way through life with pure joy and excitement. He was my best friend, my shadow, our everything. He would always say, "Mom, you just get me," and I did. I fought hard for him to be seen, heard, and understood. I wanted him to know his worth. It was he and I against the world. As he entered his teenage years, he became more impulsive and vulnerable to peer pressure. Coupled with his significant learning differences and ADHD, local schools couldn't meet his needs, so the educational consultant recommended Discovery Ranch. We envisioned a secure and nurturing space where he could focus on his studies and heal from his childhood trauma. Instead, he faced a completely different reality. He was stripped of essential rights, including access to books, phone calls, medical care, and visits home. Within days of arriving, Baruch told us that he had been choked and tackled. The therapist present had not reported this to us or DHHS. They explained he had tried to take a book without permission, and in the struggle, they all accidentally fell. A physical altercation over a book. This is when my concerns began. Months passed, and he was regressing there, hopeless and sad. We became alarmed when he shared that he and others were engaging in a game where they would choke themselves multiple times per day to escape his reality there. To our shock, the therapist dismissed this as a normative behavior. He then started on an antidepressant, and we saw a change in him that didn't reflect our son. We told the therapist we were concerned for his well-being and that we were going to discharge him. Then on November 5th at 2 p.m., the phone rang. The therapist's voice was frantic. "Something horrible has happened. They are working on him now." I screamed, "Why wasn't he being watched?" "That's why he is there." We then heard the words that shattered our world forever. Our little boy, our light, was gone. After his death, we learned that Baruch had told his psychiatrist he was suicidal with a detailed plan to hang himself with a belt for over 2 weeks. It was documented and dated in the doctor's medical notes, and no one told us or reported it. On our call with the psychiatrist, Dr. Brinkrant, just days before Baruch died, I voiced my concerns and again was told nothing about his suicidal intent. I sent 25 emails in those final days because something just didn't feel right, yet I was reassured nothing was amiss. The day before he died, his therapist had conducted a suicide assessment, cleared him, and we were never told about it, nor was he placed on a higher level of supervision. For weeks, he voiced his pain to those he trusted, and yet no staff told us or took further action to help him. Had we known, we would have been there. We were never given the chance to save our son. The Utah Department of Health and Human Services issued the facility a conditional license for failing to follow suicide prevention protocols, supervision, and more. And yet Discovery Ranch is back to business as usual while we pay the price forever. The staff and psychiatrists knew my son had a detailed plan to hang himself, yet he was allowed access to belts, something so simple and easy to remove. That fateful day, he died from someone's belt. And worse, he was unaccounted for and unsupervised for 30 minutes. He was coming home. He had an amazing future ahead of him. Now he is forever 17. Our home is silent. Our hearts are completely broken. I keep waiting to wake up from this nightmare because this should not have happened. I am no different from any of you. None of us are immune. If your child ever needed help, wouldn't you want to know they were receiving the best care? Wouldn't you want facilities held to the highest standard? I'm angry that I have to be here today. I'm angry that laws either don't exist or aren't followed. My son's death was preventable. The fact that I'm here means we are not doing enough, and we must do better. Baruch was not a problem child. He was a child who had suffered immense trauma. He was promised safety, understanding, and therapy so he could heal, and instead he was failed, and so were we. Imagine for just a moment what it's like to be me right now. My son is dead. His siblings will never see their little brother again. His cries for help were ignored, and we, his parents, were left in the dark. Can you imagine knowing that if they had just removed the belts, supervised him properly, reported his suicidal intent, or allow a simple phone call home, he might still be here today? This is what we live with every minute of every day, that this was a preventable tragedy. We brought him to America for a better life, not to lose his life. Had this bill been in place just months ago, I would have had an ombudsman to advocate for my son when I had nowhere else to turn to. Employees who are now coming forward to reveal the mistreatment my son endured there would have had whistleblower protection, allowing them to report it that day. And most importantly, the staff would have been required to report my son's suicidal intentions immediately, ensuring he received the treatment he so desperately needed and allowing his family to be there for him when he needed us most. This bill, quite literally, would have saved my son's life. Basic protection should have always been in place. This should be the standard of care, not an afterthought. I firmly believe that if Senator McHale's bill had been enacted earlier, my son would still be with us today. While it is too late for him, we still have the opportunity to save the next life. This was never meant to be our story, and I don't want it to become yours. We must strive to do better for our children, for Utah, and for Baruch. Thank you.
Thank you.
Thank you. My last presenter is Caroline Lorson, and I did tell her to be short, and she should be online as well.
Carolyn, the time is yours.
Thank you, Chairman Bollinger, Vice Chair Hall, and members of the committee. My name is Caroline Lorson, and I'm the Strategic Advocacy Lead for 1111 Media Impact, Paris Hilton's social impact organization. And similar to the voices that you will hear from today, I also went to a troubled teen industry facility when I was a teenager. In 2021, I testified in support of SB 127, which was the first step taken in recent years to remedy some of the issues that we've seen in youth residential programs in the state. At the time, there was a lot of discussion about whether this bill went far enough. And unfortunately, we discovered over the last 4 years that it did not. And SB 297 is the next step that we need to ensure that children in care are safe and that they receive effective treatment. Really, the provisions in this bill are very straightforward and commonsensical. As you heard Katie speak, if she would have had access to an ombudsman's office or another avenue, she could have better advocated for Baruch and may not be in the situation that she's unfortunately in now. So I urge this committee to support this bill. We've worked in states across the nation, and these are solutions that we've seen that work. And so I just really appreciate everyone and the support for this bill. There's been such an outpouring. So thank you again to the committee and to the members. We really believe that every child in the state of Utah and parents across the U.S. who are seeking care for their kids, it really is such an endemic issue, right? We all know someone who's struggling with mental health issues, and many of them turn to Utah for help, and they deserve help that is safe and that is effective. Thank you for your time and consideration.
Thank you.
Thank you, Mr. Chair. That concludes our presentation, but again, there is a fifth substitute online, and the fifth substitute is just being responsive to several of the concerns. The process we follow is I meet with industry stakeholders, and then I also go back and work directly with licensing to make sure that we apply these changes in a way that everybody's comfortable and continues the goal of protecting kids in Utah. But with that, I'm happy to answer questions. I know there's some members of the public that would like to comment still, but yeah.
Okay. With that, we'll bring it back to the committee for any clarifying questions. Representative Hall.
Thank you, Mr. Chair. I just had a quick question about the woman from Primary Children's that presented. What is the fix in the bill that deals with that issue? I just didn't hear you say it.
And maybe I'll bring up, is it okay if I have Amanda come and answer that? Where she's the president of Intermountain. I can tell you from my perspective, it's just making sure that payment happens. And we've tweaked that language a little bit to make sure it's appropriate, and that if Intermountain receives payment for covered services, that there's not we're not going to tack on an additional bill to a facility. But I think that's probably a good question for Amanda.
Sure. Yeah, thank you. The provision in the bill allows for hospital payment to recoup the costs of an occupied bed. It's a facility room fee only, no professional fees, but after insurance covers what they can, or if there's no insurance coverage for the patient, the remainder of the time that the child is in the hospital, occupying a bed, it recoups the space that otherwise would be occupied by another kid.
Okay, just one more quick question, if I might, Mr. Chair. I think, well, I'm wondering, I guess I don't know the process, so if someone comes from one of these facilities that needs assistance, is there a reason that they don't just get sent back home for care?
It's typically very complicated. They're usually stuck living in the hospital because the residential center that brought them to Utah won't take them back. The parents are not ready or available to take them back. And they can't access the resources for mental health in the state that they're a resident of because they're not physically located in that state. They can't access what we would normally discharge and disposition to in Utah because they're not a resident of Utah.
Okay, thank you.
We'll go to Representative Grecius.
Thank you, Mr. Chair. I largely agree with what you're doing here. I just have a clarifying question. On that fifth sub, starting on line 1279, it talks about the exception and admittance requirements for kids who are in DCFS or JJYS custody. If the program is operated by the department or under contract with the department, what's the reason for requiring the department to either be operating or contracting in that? Why is that not open to all of these programs?
Yeah, in an ideal world, we'd want to have the exact same standard, but, and this is if licensing were here, one of the concerns they had is, these are our state kids that are in custody of the state, and there are times we do have to make an immediate and emergency placement. When kids come from out of state, there's a long, drawn-out process, but there are times where we have to make an emergency placement, and that's why you have just a little bit of a different exception in those rare situations where we have to make that immediate placement. And I don't know, if somebody from licensing's here, they could follow up on it, but I know that was the real concern is when we have an immediate issue, we need an immediate placement, and it's just a different scenario than bringing a kid going through a process and bringing them to Utah.
Okay,
Great
so
question.
it's not specific to the program then, it's more the process,
Yeah,
that's the question.
yeah.
Seeing no other lights, we'll open up public comment. Who from the public wants to speak to this? Who is for the bill? Speaking in favor of the bill? And then 5 online. Let's go ahead and take anybody against the bill? Okay, let's take 3 that are for the bill, and then we'll go to 3 online. So we'll give you 45 seconds, and go ahead and sign in and state your name and who you represent. And we do have the 5th sub, and I think that's the intent, is to adopt the 5th sub. So go ahead, sir.
Hi, my name is Justin Levine. Thank you, legislators. We're really excited here on behalf of Congregate Care. I'm here for myself. I'm what I'd call a thriver of a program. And we're grateful that everyone has kind of teamed together to really, really help a bill that is practical and is something that we believe can help create safety. Our original hesitancy was there were additional factors that weren't kind of targeted and strategic, and we believe that those measures have been reacclimated and amends have been made. My life has changed completely from these programs. I'll wrap it up in 10 seconds. I was a student here. I've given back. I've worked actually and given back the last 10 years in these facilities to try to make amends. And I love Utah, and this is a place that saves kids. So thank you, everyone.
Thank you for your comments. Yeah,
All
go
right,
ahead.
good afternoon, members of the committee. My name is Jessica Black, and I am the legislative chairperson for the Utah Mental Health Counselors Association. However, today I'm just representing myself. I want to thank Senator McKell for this bill, which strengthens oversight and accountability for congregate care programs. This industry generates millions of dollars for the state of Utah each year and has the potential to provide life-changing support to individuals and their families. However, we cannot ignore the numerous instances of harm. I have seen both sides firsthand, the lasting damage that these poor care can inflict upon people. However, I've also seen the truly life-changing things that it can do when a child is fully supported. I encourage you to support this bill because it does strike a critical balance between safeguards as well as ensuring ethical and well-intentioned providers. Thank you.
Thank you. Go ahead, sir.
Thank you. My name is Scott Dixon. A couple weeks ago, my daughter and I sat shoulder to shoulder and spoke semi against this bill. But I just want to thank Senator McKell for making the amendments that he has. Some of the concerns that we brought up were we didn't want this to be legislated into unaffordability for families. It took my family 5 years to recuperate financially from my daughter being in residential treatment. Residential treatment here in Utah saved my daughter. And we know that there are so many people that are affected negatively that we've heard stories from, but there are so many people that have been affected positively by this help. So thank you for making those fixes.
Thank you. I did say the first three, but since you're up here, we'll give you 45 seconds, okay?
Thank you.
Go ahead.
Thank you, committee, for taking a moment to hear my comments. My name is Trina Quinney-Packard, and I'm a CEO of one of the congregate care programs, and I'm also the president of the National Association of Therapeutic Schools and Programs. And on behalf of all of us, we'd like to express our appreciation to all the folks that have been a part of working on this bill. When this bill started, we were definitely opposed to this bill, and over the course of the last couple of weeks have worked very collaboratively with Senator McKell and the state, and we very much appreciate the collaboration. We realize there's opportunities to do better. We realize there's opportunity to create best practices, and we appreciate all those who are continuing to balance and create a balanced approach in working with congregate care programs. So thank you.
Okay, thank you. We're going to go to the first three online. Avital Van Luthen. Sorry if I butchered your name, but turn your camera on and state where you reside and who you represent.
My name is Avital Van Leeuwen. I live in Los Angeles. 14 years ago, I was kidnapped from my Los Angeles bedroom and taken to a Utah program called Alpine Academy. The next 10 months were the most traumatic and damaging of my life. I was falsely imprisoned in complete isolation from the outside world. I was not mentally ill, but my mother had Munchausen's by proxy. Though I had no criminal history, I was held like a prisoner without due process of the law, brainwashed using cult tactics, drugged, and emotionally abused every single day. Contact with our parents was always intercepted, and if we spoke up about the abuse, our parents were told that we were lying and manipulating them. I'm here to speak for all who have been silenced. This bill creates much needed, long overdue oversight for Utah's congregate care programs, which are rife with child abuse. I only ask the committee to carefully consider the language in this bill. Please do not include current or former troubled teen industry staff members and program owners in the oversight committee. This is a conflict of interest.
Thank you for your comments, ma'am. We're going to move on to the next comment. Leah Hansen, the time is yours. Turn your camera on.
Can you hear me okay and see me all right?
Yep, we're good. Go ahead.
Good afternoon, Mr. Chair and members of the committee. My name is Leah Hansen, and I'm a constituent out in Saratoga Springs. I am just wanting to speak in favor of this bill and thank the good sponsor for the work that he has done on this. I've been following this bill throughout this session, and it has been such an eye-opening experience, and just really grateful for him. Thank you.
Thank you. Last one online. Dean Jeffries Goodwin. Turn your camera on and state your name and where you reside and who you represent.
My name is Dean Jeffries L. Goodridge. I'm the father of Taylor Goodridge. She was a Native American of the Stillaguamish Tribe of Indians, born in Arlington, Washington. December 20th of 2022, we lost Taylor at Diamond Ranch facility. She basically died of an easily curable infection, which if she was taken to a doctor, she would still be here. I'm totally for this bill. If this bill was in place, Taylor would still be here with us. Thank you, committee.
Thank you for your
comments. Let me speak.
Thanks. That will conclude our public comment. We'll bring it back to the committee for any questions or action. Representative Clancy.
Thank you, Mr. Chair. I'd like to motion we adopt fifth substitute.
Okay, the motion to adopt fifth sub. Any committee discussion that motion? Representative Abbott, did you have discussion of the motion? Just, okay, gotcha. So seeing none, to the bill sponsor,
Yeah, thank you. I explained those changes, so thank you.
back to the maker of the motion. I'll go ahead and place the motion to adopt fifth substitute SB 297. Those in favor say aye. Aye. Any opposed say nay. Rule that motion passes. Representative Clancy.
And motion that we favorably recommend fifth substitute SB 297 out of this committee and on the House floor.
That motion is in order. Do you want to speak to that motion?
Very much needed bill for standards of care for youth who are in vulnerable positions. So thanks for everyone who's worked on this bill with Senator McKell. It seems like it's got to a great spot.
Thank you, Representative Clancy. Discussion of that motion? And let me get to you. There you go, Representative Abbott.
Thank you, Mr. Chair. So I do have a question for the sponsor. Down in this section in 1348 where it's requiring the facility to pay 85% of the billed charges at a healthcare facility.
Yeah, so on that provision, what you'll see is we set a floor. Originally, it was going to be the PHP rate, and then I know we worked it back and we set an 85% rate. But you'll see in the substitute, what we did is we're still protecting these facilities. If they bill and it's paid, then you're not going to see an excess on top of that, and that's the next line that's in there.
So my question is,
Yeah.
is there any protection to make sure that the healthcare facility bills insurance? Because I do see that you have the protection, but what if the healthcare facility just is not cooperating in billing insurance because the 85% is higher than what they would collect from insurance?
Great question. That's something we've wrestled with and thought about, and one of the reasons you'll see it above the lines above in 1337, 1339. Healthcare facilities shall bill, private or public, and you'll see those shall provisions. We want the insurance billed, but we also to the point of Intermountain, we don't want there to be an incentive to keep the kids there long term. We want to take care of kids, and that's why primary children is here, but we want them to leave as well. If they're coming here to get treatment, that doesn't mean in primary children's, but that's where those shall provisions are there, and then you'll see some of those protections in that substitute.
Okay, thank you.
Senator McKell, do you want to sum on the motion to recommend favorably?
Yes, and thank you, committee. I know we took up a little more time and you got a busy agenda. I appreciate Katie coming online. Her story's tragic. I appreciate Dean jumping online. Her story's tragic. I appreciate the industry working with me. Over the last 4 or 5 years, I thought, how do we improve this? How do we really make a difference? And I think adding professionals, adding this advisory board with professionals, the Stuart Barlows or the Ray Wards that are physicians, the pediatric physicians that have behavioral health experience overlooking this, adding an ombudsman. One thing I didn't mention before, but since that bill passed, 7 kids have died in congregate care. I know every situation, and I know where they died. I had 3 die within 5 miles of my home. And the idea behind this bill, I don't want to overreach, but I want to address the concern so it doesn't happen again. And when I think of Katie's experience, when I think of Dean's experience, losing their kids, we just need to do better. And with that, I appreciate this committee hearing that and urge support.
Okay, thank you, Senator. We'll go back to the maker of the motion for some.
I'll waive, thank you.
Okay, so I'll go ahead and place the motion to recommend favorably SB 297 fifth substitute. Those in favor say aye. Aye. Any opposed say nay. Rule that motion passes. Thank you for your time.
Thank you.
Thanks for coming in.